on platform, and I hope you love the webinar.
Thank you all for joining us, and I hope all of you participants enjoy, because these are the questions that you have in your mind that you could not answer or question the speakers directly. So we will try to answer all your queries over here. We will have a series of rounds with every speaker that I would be asking questions for, and at the end, if we get more time for it, I'll let you give you time to ask questions that you can send in the chat box, and we would be glad to answer it. So we start with the webinar. Here we go with the first question that I have for my first speaker. Maru, it's for you. How does disaster management relate to you as a comedian, and how many countries could conduct disaster management training for undergraduates? Since you've been working in the international team and you're also the director now, can you briefly tell about your experience in relation to the disaster medicine with this medical education, any projects you did, or how does it relate with it, or do we have any common grounds with the disaster management that's under SCORP and the medical education as a whole?
Yes, thank you, Maha, for this question. I think it does relate to everyone, not just comedians, disaster medicine, because regardless of our affiliation in IFMSA or our background in our work in general, and even outside of the Federation, it does relate to all medical students, because we are at the end going to be the future workforce that is going to be supporting the health systems, especially in times of disasters and in circumstances, for example, like these that we are going through in the current pandemic of COVID-19. I think it does relate to everyone, especially when it comes to the context where medical students are being put to, because it does, as from my experience, medical education and medical curricula are shaped by the contexts and the environment that they are in, and it does relate in somehow to the needs of the communities and the need of the nation that medical schools are being part of. So I think this question, it leads us to asking how we can make sure that disaster medicine is part of the learning objectives of all medical students, wherever they are, because as this current pandemic has proven us that all of us are vulnerable, because the previous idea that we had is it does relate to certain nations, because, for example, we are accustomed to seeing more of natural disasters such as earthquakes, floods, or any other natural disasters. But for example, some other nations that where we do not see these current, for example, natural disasters, it's not that common for medical students to reflect on disaster medicine. But I think the current pandemic is quite changing the mindset of medical students in a way that they are more now being related to disaster medicine, and they are more now aware of the importance of our education addressing disaster medicine. There are many countries, like from my experience, that I have noticed, whether as activities conducted by medical students or just me going through literature to understand more about disaster medicine. I noticed, for example, that Germany has in their medical curriculum a disaster medicine elective where medical students are can go through a program of education that will last in, I think, 12 weeks, and it's a program that is proposed by the German government in a way that all medical schools should incorporate it in their medical curricula. Another example, I would go to Italy, and it was something co-initiated by medical students, and it was called Disaster CISM. It was initiated by CISM Italy, and it also has won the Rex Crossley, I think, in 2014 or 15. I don't remember. I just joined IFMSA back then. But it's a really good program that was initiated by medical students in Italy that make sure that they train medical students in a peer education fashion on disaster medicine and disaster management, and how can medical students play a role in this process. I think they have in their website or sort of in their platform a full description of the activity, and also like I can share it with you afterwards so you can hear more details about what they do.
Thank you so much for an elaborative answer, Mario. That leads to me to my next question. That's quite quick for you. That you've already explained what is it, how does it feel for you, and how does it relate to all of the medical education as a whole. Then, what my question would be for you is how a medical student can advocate for incorporation of disaster management in the curriculum, because IFMSA is all about, if I say it's all about advocacy and capacity building, it wouldn't be wrong. So anything that we initiate goes through a special protocol and a process, and we cannot directly approach our teachers or approach the management and tell them, okay, this is happening in the world, we want this here too. So can you tell us the exact protocols, like how can we approach a person in the faculty or be whatever to have disaster medicine or like disaster related studies incorporated to our curricula? That's equally important for us as it's for all the countries that are out there.
Yes, I think we already got the answer in the question, which is, as you have said, IFMSA is all about capacity building, education, and advocacy. And I think this is like a formula that we can use in order to make sure that as medical students, we advocate for disaster medicine and disaster management learning and medical education. I think it should start with capacity building, so we can enable medical students to understand the scope of disaster medicine and disaster management, and to which extent it is related to their own communities and to their own environment, in a way that they identify themselves with the need of learning disaster medicine in general. So it starts not only with capacity building about what is disaster management and disaster medicine, but also capacity building on advocacy in medical education. And that is something important that should go in line with any process if you want to be medical education advocates. I think it's very important to start with this step and then go forward into not only within the walls of our medical faculty, but also outside the walls of our medical faculties, in a way that we look into our communities and see where is the need of learning disaster medicine in medical schools. And I think now there is a certain type of need for us to learn about disaster medicine or our immersion into emergency medicine, in a way that we can see how we can be involved in as medical students. And I think, for example, during the COVID-19, many countries where we see an involvement of medical students, it always started with building their capacities. And I think this will start a reflection on whether they should continue this initiative like beyond the pandemic, in a way that we ensure the preparedness of not only the workforce in general, but also medical students as part of this workforce. So definitely it should start with capacity building and identifying the needs of our communities to see how much and to which extent we are vulnerable as an environment to disasters. And then afterwards we can see from these needs what are the competencies that we can implement in our medical curriculum, so we can make sure that we implement them through different educational strategies and look into the literature and the good practices uh, from other medical schools in a way that we implement them in our curricula.
Thank you for your answer, Maru. That leads to my next question. And now, when we're all geared up to approach the person, we know who to approach and where to head to. My next question would be for Pablo. How can doctors and medical students be trained to deal with patients, attendants in the emergency settings? Like, after knowing all of it, do we really need this training, or like medical students come with build-up of like all the situations they have to put in? They don't feel panic, they don't feel the fear, so they don't have to get trained with it. What's your stance on that?
Sure, and thank you for the question. So it's really important to acknowledge that until this point, students have not, and medical faculties have not given the importance of preparedness in medical curriculum for students. And this makes sense because if you compare or put in a balance, like how much effort and resources you would need for making curriculum prepared for disaster medicine, it will take a lot of effort, a lot of resources. While it's important also to see that schools or countries who were more prepared in this situation, in this COVID-19 situation, had a better response, right? So how can students be trained? Let's say that medical faculties want to invest resources and time. It's really important to set fake settings. So it will depend a lot on the different scenarios that countries have. So, for example, in Ecuador, where I'm from, we have a lot of natural disasters. For example, volcanoes, an earthquake that 3 years ago strike really hard here in Ecuador. So it will depend a lot of which different settings and natural disasters you might face for setting a medical curriculum regarding disaster medicine, but also to have the resources in the different universities for setting, for example, hospital simulators where, I don't know, disaster happened and you as medical student would need to practice in that scenario. So it's really important for doctors and medical students to get trained in these different areas according to their particular scenarios. Also, to just remark, of course, at this point, the world has shown that is not prepared for this kind of disaster, but it's also a huge call for action for the future. So yeah, that would be for how doctors can be trained.
Okay, thank you, Pablo, for your extensive answer. That was really nice to hear the perspective. My next question would again be you, as you started from telling that how it should be incorporated into the medical schools and what's its importance. Can you precisely tell why should it be taught in medical schools? Because we all know the importance, but is there a big why out there that that can convince more people that are setting the medical curricula or in the authority, that we can justify that yes, this is the why that we should have disaster management to be taught in the medical schools?
Yes, and of course, a great question, because like whenever you're dealing with decision makings inside a medical school, there will always come the price. Why should I invest my time and resources and teachers in this? And the answer is it's really, really simple. If you see that countries who were more prepared, medical schools and medical education systems who were more prepared for disaster medicine had a much better response. So of course, there's an investment that everyone should do. Students, because it means studying more, getting some electives and so on. But the reason why should medical schools do this is that most probably you won't see the result until you have a disaster. So the be prepared is actually an investment for the future. Actually, there's some research saying that if countries would have invested in preparedness for a pandemic, that it's more or less between $1 or $2 per person per year, they will be prepared. And the same is for medical schools. If, for example, medical schools start investing in having, let's say, last year students having a training or having, let's say, a workshop on disaster medicine and how to act in different scenarios, whenever there's a huge pandemic, it can be an earthquake, it can be a tornado, whatever, at least we will be sure that this segment of medical students will be ready to act. Because what happened right now is that it was a lot of improvisation, like a lot of things just came up and they had to make up from zero. They didn't have the experience. And that's why we also see a huge issue that happened around the world, that many medical students were exposed to situations and dangerous situations where they didn't have the equipment, the protection equipment, they didn't have like the preparation for dealing with this situation. So if medical school will start investing, let's say a percentage, and having at least, let's say, a small team ready always for any kind of disaster, that will show some benefits, not immediately, but whenever there's this different kind of scenarios that can strike anytime, and nobody actually knows when they can happen.
That's a very nice answer and clear some of the queries I had in mind. I'll jump back to Maru again with the question that how can, like, now we know that like we're going with the sequence, we just have a why to like defend ourselves, that why do we want it. Now if I come to that point, there would be a question that everyone would have in mind, that how can medical students differentiate between the emergency medicine and the disaster medicine? Is it the same thing? Is it one part of another, or what is it totally?
Yes, thank you for this question that I also like had in mind, and I always had this question in mind as a medical student, and I was not clear about the difference between the two fields. But I think that there are many different type of schools or that use different terminologies in a way that it depends on how they are functioning as a health system and as an educational system. I think emergency medicine is, as for example, from like the school that I come from and the health system that I come from is more about emergency medicine, is more about the acute medicine and anything that is related to acute cases that come to the emergency department and patients come in with acute illnesses. However, disaster medicine is quite a more specific field that is related to more of unforeseen and force majeure events that can change the environment of communities overall, and that can make them vulnerable to several health conditions and different casualties in general. So there are different use of terminology. Sometimes you find in different health systems that emergency medicine is more referred to as acute medicine and vice versa. So yes, it depends on the health system that we are working on. But in general, that is terminology that is used so we can make things very clear for medical students.
I'm Sharbana Rai, National Officer on Human Rights and Peace from Pakistan. Okay. So I will be directing my next question to Aksa. Aksa, can you hear me?
Yes, Sharbana, continue. I
Aksa,
can hear
can
you.
you hear me?
Yes, I can hear you. Continue, Sharbana.
Yeah, Aksa, so my question from you will be, what steps do we need to incorporate disaster medicine in undergraduate curriculum in Pakistan? And what should be the undergraduate disaster medicine curriculum in Pakistan?
Okay, thank you so much, Sharbana, for the question. Before coming to the steps, I'll like to talk about what the curriculum should be. First of all, the curriculum should set out the intended aims and objectives, the content, the experiences, the outcomes, and the processes of the educational program that we intend to provide during the course of creating emergency physicians. who will have the knowledge and expertise to be safe experts and independent practitioners functioning at consultant level, including airway care, diagnostic testing, and everything from triage to getting the patient out of the bed should be included. As far as I've seen in Pakistan, and considering what we have been teaching at undergrad level across the globe, I have outlined some of the basic courses that are being carried out across the globe, and I would like to include for Pakistan at least, the course should have basic life support, BLS, advanced life support, ALS, advanced pediatric life support, APLS, advanced trauma life support, ATLS, emergency medicine ultrasound, EMUS, PALS, patient advice and liaison service, emergency medicine non-technical skills, EMNTS, behavioral sciences competencies relevant to the disasters or emergency medicine, psychological education in regard to disasters and their mental health impact, as well as how to tackle such situations, and advanced counseling techniques in such scenarios. Besides this, curriculum is always incomplete without assessment. Where there is content, there's always assessment. And unless until you assess someone, you cannot professionally call that person a trained personnel to be able to train someone else junior from them. So there are some assessment criterions across the globe that are being carried out for emergency medicine or disaster medicine. These include ACAT, Acute Care Assessment Tool, case-based discussion, direct observation of procedural motions, that's DOPS, and life support courses. These include hands-on assessments of the physicians who are actually going through this course. And this is sort of the curriculum that I see in Pakistan that can be carried out in our institutes at undergraduate level. And the second question that you asked me is that how can we actually go about creating this curriculum? Okay, so first of all, I would like to say there are certain steps that can be taken to incorporate anything into a curriculum, not just emergency medicine or disaster management. And what I will be pointing out would actually be the crux of those steps as well. First of all, we need to identify any member of our institutes and any student from our institutes need to identify the need to incorporate emergency medicine and disaster medicine in an undergrad curriculum. They might need to have a survey or see its relevance elsewhere in other countries, in other institutes in Pakistan, or any place where they have similar settings. Second step would be the person who is taking this initiative, who's taking this stance, needs to be willing to take the lead and stand firm in this path. Third point would be to educate yourself. If I'm taking this initiative, I need to educate myself about various systems and educational strategies other than those taken by institutes or countries that have been employing emergency medicine and disaster management. Then I will jot down the key points, including aims, the why, the objectives, the content, the future consequences of incorporating the particular topic or subject into the curriculum, or give enough importance to it in your setting particularly. Then I'll go to step 4, which is to identify the faculty members. Since I'm prepared now, I can approach a faculty member with the right knowledge and the right approach. And this faculty member needs to be one who will appreciate your stance and collaborate with you. So this member needs to be identified through constant approach with the administration. And I will be talking about who this person can be. This can be your dean of community medicine. This can be your medicine head or medicine trainee, or this can be anyone in surgery who has any close contact with your administration, your vice principal or principal. It can be anyone in behavioral sciences subjects who's teaching these subjects in your clinical setup or your educational setup. Other than that, next step would be to approach potential organizations and sign memorandas, MOUs with them, and establish short courses which can be utilized as simulations for peers. When I talk about simulations for peers, it's just for the purpose of getting attention to get your peers to know the importance of the course that you are going to introduce as accountable member of the society. So this will lead to our step 6, which is after getting enough attention and advertisement to your peers, create a team with potential interested students. Once you have done that, you can create a proposal with them, sit down, have a team, create a proposal, list what organizations offer, the course offers, and the faculty involved offers, and also mention what is requested from the institution. So once you're done with this, you can go towards those administrative faculties and put forward this proposal with them with the backup that you have from your other faculty members. Then you have step 8, where you stay put. You keep going back and forth with administration till you get enough support with your faculty already on board for the cause. This leads to you to step 9, where you have to train enough members in junior years to take the lead when you are no longer able to give as much time in training years. Because once you have started the curriculum and you start from a scratch, and you are giving just, let's suppose, BLS and ATLS, or you're just giving BLS and acute trauma support care, you need to incorporate other things slowly and steadily, and this can be only done when you are in touch with those who are currently in the system. So this needs you to train enough members who can carry the act after you are gone. And lastly, once you have reached a point where you thought you would be going to, you have reached a place where you have incorporated certain aspects of disaster medicine and emergency medicine into your curriculum, you can preach what you have achieved and capacitate members about how and why. I think that answers the question. Thank you, Sharbanu.
Thank you so much, Aksha, for this comprehensive answer. Maha is back and she will take over the webinar from now on. Maha, you can continue. Maha, are you there? Okay. I think she's having some problems, so we'll continue. Okay, so I will be going with my next question. This question is from Maru. Can you hear me?
Yes, we can.
Yes, perfectly.
So the question is, how can medical students be trained to handle ethical dilemmas in emergency rooms? And what ethical dilemmas can they face and how can they handle it?
Thank you for this question. I think what are the substantial decisions that are can be put in that situation, and then we can, for example, address what are the ethics rules and laws that shape our decisions and medical professionals in that situation. So I think simulation-based training plays a huge role in teaching medical students not only about the disease-related aspect of disaster medicine, but also it's related to the ethical aspects and the decision-making aspects as medical professionals, because we are put in a disaster in an environment where that is not usual for us and that is not conventional for us as medical professionals and in general as communities and as patients as well. And we need to make out-of-the-box decisions in a way that we make sure that we deliver equitable and fair healthcare for all the victims of disasters and for all patients that are there. So I think that this can play a role in not only for example, for disaster trainings, but in general, it can be having a holistic approach as ethics training in a way that we prepare medical students uh, for thinking and thinking about ethics and deciding on fictional situations and simulated scenarios, regardless of whether it is disaster medicine or not. And I think that ethics education can play a major role in this process. So yes, simulation-based training is one of the main the main educational tools that we can use not only in medical schools but also as if you want to organize a peer education training, we can also have simulation-based scenarios for medical students, so they can see how their role should be as the future health workforce in disaster medicine.
Thank you, Maru, for your answer. Can you hear me now, guys?
Yeah.
Perfectly.
Perfect. Okay, so that was a very nice answer. That leads to my next question to you, that is, Pablo. Now, when we have all of it, and now that we know that what are the dilemmas and how we have to deal in the emergency rooms and all the ethics and that comes after, is the absence of this very training in the educational programs leads to any issue, or does it affect our healthcare system? My question, I feel that they're all the same, but they're asked in a different scenario, so I can get the best crux out of you, expert. Because you know that if I ask simple like that questions point by point, that wouldn't give a bigger picture of it. So even if the same one, I think that you have explained it earlier, but can you emphasize it more on the fact that what would lead to a health system if there would be an absence of such system?
Yes, thank you so much, Mahan. Even though this might seem a similar question, it's true. The approach is quite different because, like, the effect that not being prepared in our medical education for a disaster, for disaster medicine, is actually quite important for our health system. And you will ask why. From my personal experience, I've seen colleagues who are already doctors who have even faced fear or have this reluctance of going to hospital because many times there's this lack of knowledge of how to deal with this kind of disaster medicine, right? So imagine that it doesn't really matter if you're a medical student from last year, you're just graduated medical doctor, or you're even a specialist. Whenever a disaster happens, society is waiting for you to act. And what happens when our healthcare system have not prepared or have not invested enough resources on the medical field for this, is that the reaction and the response from all the different areas of the health sector, talking about medical schools, talking about the health system per se, the individual medical doctors and also the healthcare professionals, will not have a unified health response, which will lead in misuse of resources, will also lead on this fear that we have seen in medical healthcare professionals when dealing with these unknown situations and unknown scenarios, right? So how can we prepare, or how can we strengthen our healthcare system? It's quite easy. We can start from the roots. We can start from the basis. So if we prepare our medical students for future disasters, what we would have is that in 10, 20 years, those medical students who will be already doctors, many of them will be policymakers, many of them will have like authority positions, will be able to actually acknowledge the issue and acknowledge that we need to unify the response that we might have as healthcare workforce. So it's really important, the approach, that the effect that we can see right now, how healthcare systems have response, can actually be an improvement if we talk in long term. So in 10, 20 years, if we start making this change from the beginning, from our medical students. So I hope that answered your question, Maha.
That does perfectly well. Thank you, Pablo. That leads to my guest that I think that I've left out for a while, Jessica. Since we're all talking about ethics, so can you please answer my question that what are the ethical guidelines for development of emergency plans in, let's say, hospital settings or in general?
Well, thank you for the question. It's a very interesting and a very, very big question. So these kind of ethical guidelines would exist in order to help us make decisions that are just, humane, and responsible, both before, during, and after a disaster. And there are some publications regarding such guidelines, but I don't think there is any universal, simple answer. So essentially, these guidelines say that we should act fairly and consistently based on people's needs. We should try to not cause harm, and we should also try to prevent damage before it occurs. And the work that is done should be transparent and inclusive, and actors should be accountable for their acts. And also, the limitations we might have to impose in the community, such as lockdowns we're seeing today, should be proportional to the benefits they have. Now, we have to look at public health not only from the medical perspective, but also social, economical, political, and so on. And this is far beyond of what most of us medical doctors and health personnel would be expected to know and to do, because emergency planning and emergency response is so much more than medicine. We're talking about managing economic loss, destruction of property, disruption of social services, environmental damage, and so on and so forth. And I'm certainly no expert in this, and you won't be after this webinar. So if you're really interested, I would recommend you to read up on it, maybe do a master and so on. But for us as medical students, healthcare students, and professionals, I would say the basic ethical norms are quite consistent. So if you know your medical ethics, most of it would be more or less applicable when you do your emergency planning as well, because we're talking about doing good, not doing harm, not discriminate, and so on. And I would also emphasize the attention we pay to vulnerable groups, because marginalized groups tend to be even harder affected when emergencies strike. And in this COVID pandemic, we've seen in many countries how people who belong to lower socioeconomic classes have been hardest hit by the disease. So we have to reflect on our public health interventions. Who do we reach? Who do we miss? And that's a really important part of it if we want to be ethical. And finally, of course, the planning needs an interdisciplinary approach, and medical doctors might not be the center of attention, so we have to collaborate with other professions. Nevertheless, I would also encourage all of you to know the social determinants of health. Although we might not be the experts working on all of the levels, we should be aware of how the different levels affect our patients and their healthcare. And I think we can also try to share some further reading, maybe, if anyone is interested in that, but I think I'll keep it there. Maha, can you hear me?
Maha, can you hear me? Okay, so we will go to the next question. I will ask the next question from Aksa. Aksa, what can be done to advocate the incorporation of disaster medicine into Pakistani curriculum, and what role can IFMSA Pakistan play in it? Also, what opportunities do people who want to pursue disaster medicine have in Pakistan?
So first of all,
Did you hear my question? Okay.
Yeah, I did hear your question. Thank you so much, Sharvana, for the question. First of all, we need to approach the officials. For example, as I mentioned about community medicine department head, clinical professional, anyone who's trained in critical care and is in charge of ICUs or is an intensivist in your hospital or your institute. Even if this person does not have enough time, he must be able to help you with the documentation and the work required for the proposal and the approach that needs to be taken. Other than that, you can approach other members who are close to your administration and who have a say in their administration level with the vice principal or principal. Lastly, there's always a basic sciences dean or head who supports and backs the student in such initiatives, and they are at the forefront in non-academics as well, where they let students have non-academic activities just because they're backing them up. When you are done with having approach from all the officials in our Standing Committee on Human Rights and Peace, which include yearly disaster management training at our pre-National General Assembly and BLS and Rescue 1122 training at various institutes throughout the year. And in recent years, we have graduated 10 plus training human rights trainers and have members who are certified international trainers of disaster management through Criterions as well. We can work with the institutes and provide these resources, these students who can give motivation as well as the right knowledge and the right training to the students who are interested and motivated. Other than this, IFMSA Pakistan holds the potential to create a national network, and by this I mean to create a national student task force on disaster and emergency medicine. The purpose of this task force would be to create readily available courses and provide human resources as course trainers in various institutes. This can easily be done by identifying major disaster management trained professionals across the country. And this is an initiative IFMSA Pakistan has discussed with the advisor to Health Minister already in a meeting before the COVID situation arose. And we're working on its basics to make it happen in near future with the support of the government. And I would rather call motivated members from our NMO who would love to collaborate with us in creating this proposal, in being the core committee, who would like to be part of the student task force. Once we're done with the proposal and once we have finalized a core course, we'll be opening calls for that. And yes, this is how IFMSA Pakistan can assist you in your venture to have established a curriculum in disaster medicine and emergency medicine institute. I hope that answers the question. Inshallah.
Yes. Aksa, can you hear me?
Yes, we can.
That's one of the disastrous impact that I'm having right here in my home, because my internet is being a disaster today. So that leads to my next question to Jessica again. If I were here, Jessica, I were to ask you about it before, but it's never late. What would be the medical ethics, particularly in handling disasters for healthcare professionals? So are there a list of it? Are there a lot? We get a paper when we enter the medical, the unit, or are we as medical students? Because if you're talking about your country, it's of course a developed one. I am asking a question according to an underdeveloped or a developing country, because here we're not told about it. We are just kind of we're in a kind of a situation, or you say a system, and we are just put into something and we are told to do it. We don't know how, we don't know when, we don't know what resources we have. We just eventually find it out. So can you answer my question according to the scenario, considering the situation that would be there? Of course, you wouldn't know it at its best as I do, because I'm part of the system here. But what do you think? What are the medical ethics that are there in handling the disasters for healthcare professionals?
Also, a very good question. If you want a list, literally, then you can look for the World's Medical Association. They do have a statement on medical ethics in the event of disasters, so you can Google that. And they essentially state that a disaster is a situation where there is a sudden imbalance between resources and capacities on one hand and the needs of the patients on the other hand, which means that everything just gets much harder because you can't do as much for the patients as you would normally do. You can't uphold the normal standard of care, and that's somehow a part of the definition of a disaster. So we have to move from doing the best we can for every single patient to what is best for the community or a bigger group of patients. But I would kind of once again say that the medical ethics, the ethical considerations aren't that different. They are as valid as always. So in the IFMSA, if just to repeat medical ethics, we like to use the abbreviation ABCDE. So then we have A for autonomy, B for beneficence, C for confidentiality, D for do no harm or non-maleficence, E for equity, and F for fairness. And these are the same considerations we keep in the back of our heads in a disaster, although everything becomes much more harder because we don't have the resources and because of other challenges that a disaster usually poses. And we might not be able to treat all the patients the way we would normally treat them, but this should not prevent us from treating them humanely and with compassion. And we might have to triage in a different way, we might have to set different priorities, but these should still be strictly based on medical needs. It should be equitable, and it should be fair considering the limited resources that we have. I hope that answers the question.
That does, and quite well answers it. Okay, since we're heading to the last 10 minutes of the webinar, hope, and like if we have questions from the participants, that would be very good. Otherwise, I'll go with the questions that I have in mind that are already collected from the participants too. My next question would be to Maru, and it would be: is the absence of disaster management programs a major issue in the lack of knowledge and training of health professionals regarding the disaster preparedness? So I asked Pablo the question about, explained how it's useful, what the absence would do, but to you, my targeted point would be what's the training of healthcare professionals regarding the disaster preparedness. So it's not just the disaster medicine, but we are heading to the management part itself. And I'm asking and particularly focusing on the preparedness point over here.
Yes, thank you. As Pablo has mentioned it earlier, you can clearly see the correlation between the health systems where they have trained their workforce in a way that they are prepared for disasters or any other circumstantial events versus those who haven't, and you can see the level of the responsiveness and level of response and the level of preparedness through the management of the disaster, however it is. I think when I looked into the literature, it's disaster education was mainly directed to the postgraduate level in a way that all the educational efforts are targeted and focused on, for example, residents and more of the postgraduate level than the undergraduate level of medical education, in a way that we make sure that we provide all the medical professionals that are actively working in our health systems with the right knowledge and skills in a way that they can be prepared for disasters and their management. As for the undergraduate medical curriculum, it's quite difficult to incorporate this alongside with other healthcare needs that are also quite still push a great demand from our communities, because even though like we are facing disasters, there is still, for example, other healthcare priorities such as, for example, NCTs or maternal health, etc. So there is also like undergraduate medical curricula are taken a balanced way to make sure that they create a balance between all of these fields and make sure that they provide medical students with the basic knowledge and the basic skills in a way that they can be prepared for future trainings as well. So I don't think that training on disaster medicine is just one elective or just one that can be happening once in a lifetime, but rather it's a whole continuous process that can go with the different levels of medical education, whether undergraduate and even postgraduate, and a continuous professional development. And that can also involve not only medical students, but also all the medical professionals, primary healthcare physicians, even, for example, medical professionals as educators, because alongside with disasters, they can, for example, as we are living in the current pandemic, we even as educators, they do not know how to adapt, let alone because it's something new, it's something that unprecedented, and we should also be constantly and concomitantly adapting to the situation. And that would lead us to the need of also preparing the educators as well through continuous faculty development, in a way that we prepare our educational programs to adapt to disasters as well, should they occur in the future as well. So I think medical schools, they should be looking into a way that they do not only provide medical students with the knowledge and the skills, but also implement a whole set of action points where they can target all of its components, whether it is medical students, medical professors, residents that are affiliated to universities, research department, because let's not forget about research, because it's one also very good aspect that medical students can be still involved during the pandemics, and that can also serve as an educational alternative, because not all medical students had the venture to be involved actively as a workforce in the delivery of care during, for example, in emergency departments, but they can also be playing a role in the lab, as we can label it, through research, whether it is research related to the practice of disaster medicine, or the health impact of disaster medicine, or education as well. So that is also an important aspect that we should not be overlooking. And that is something that also can be implemented by medical schools regarding disaster medicine education.
So yeah, thank you so much for the answer. I'm so sorry to cut you short at this point, but since we're heading to the last few minutes of the webinar, I'll quickly ask one question to Pablo and then head over to our other speakers. Pablo, this is for you. That if coronavirus 19 pandemic is a disaster, do you think that it would have been better managed if we had a handful of disaster medicine specialists at hand and they were to lead the situation, like prior knowledge? Because of course, no matter if we have experts these days, that doesn't matter that we have a hold on the virus, we still are nowhere. But would it make any difference if we had experts, or if they had prior knowledge about it? Would there be any difference with the preparedness situation at this point?
Yes, thank you, and definitely. I mean, like, there's really a few countries that were actually with enough resources, human resources, and also like hospital beds in ICU and so on, prepare for this COVID-19 pandemic. But what is a fact is that it would have been much better managed if we would have had some experience in pandemics, right? So we saw a lot of, for example, ophthalmologists going into the front line. We saw a lot of gastroenterologists going into emergency rooms. So we saw that the system anywhere was really prepared, in the sense that a lot of specialties and medical doctors and healthcare professionals who were not intended ever to be in this kind of situations were pushed into emergency rooms, into treating respiratory patients, which was not their background, right? And not even just like in the healthcare setting, but even in policy. Many countries have faced the change of leadership with their health ministries, with the heads of hospitals, because people were not prepared for this. So I think now we are in a break point that in many sectors we will start preparing ourselves for a second outbreak, because it's a fact that it will happen. And we will see that societies, that healthcare systems, that countries are much more prepared, because they have seen the face of the wolf, as we say in Spanish. So yeah, I think from this point we will see a lot of changes, and especially new generations will be benefit from this, let's say, lessons from the pandemic. And yeah, we will have deal with this situation much more efficiently if we would have the experience from previous pandemics.
Pablo, consider me a participant, and I have a question for you. That's a different one that just came into my mind. As you just said that we didn't have experience with the pandemics. We did kind of had two of them earlier this century. We had MERS and SARS. One of them was considered, if I'm not wrong, was considered a pandemic at that point. So what would we have done at that point to be at a better state at this point?
So it's quite interesting because even the scientist community already warned several years ago about, because of the SARS and MERS, that this might happen again. What was the issue? In the international community, it wasn't given enough importance about the potential outcome of a pandemic, even though the scientific community knew that sooner or later it would happen. So if I would say why now everyone's so worried about the situation, is because the impact was much higher. Sadly, until you don't face by your own experience what a pandemic looks like, it's really hard for different sectors to join together for acting. So I think sadly, even though this pandemic has hit us really hard, for the future situations, this will lead into a much more preparedness and much more investment in research, much more investment in strengthening, in making stronger healthcare systems and universal health coverage as well. So probably from all these bad situations, we can get some positive learnings for the future.
Hopefully, because it's never too late, and we are not sure that if we have more pandemics, God forbid, in future. This leads to the end of these webinars with the last few questions to our very nice guest and speaker, Jessica. Jessica, as you were also our Director of Human Rights and Peace, so you would know about the mental health. This doesn't mean that all of the rest of my speakers doesn't know about the mental health, because more doctors know about mental health more than anyone else out there. So how would be the mental health of a disaster medicine specialist is affected? What's the rate of any post-traumatic syndrome symptoms in that, or do they have it in the first place or not? I will ask you a couple of questions, but I think the crux of all of it would be the same, if it's happening, if it's not, and what and why do we give it a lot of importance these days? Sorry for jumbling up the questions, but I think that one of your answers will lead to the answer of the last one. I feel like I'm in a scavenger hunt right now, but yeah, that's how we end up the webinar.
I think that's a really nice question, because I definitely think we should talk more about mental health, and not the least mental health amongst medical professionals, because we are definitely affected by disorders such as PTSD, post-traumatic stress disorder, and so on. Unfortunately, I cannot give you a number, because I don't think there is really a number, due to a number of reasons. Marwan was already mentioning the difference in the terminology between countries and so on, and the situation in different countries. But in general, I would say, or rather, data shows that doctors do tend to suffer higher rates of, for instance, PTSD. And this goes especially for emergency physicians and so on. Now, I also believe it might be hard to get really reliable numbers, because there is still a lot of stigma connected to this, which is something we have to fight against. And emergency doctors facing PTSD, for instance, might be due to a number of reasons, such as experiencing these kind of life-threatening events, but also witnessing others suffer through them, hearing about the trauma of other people. And this might be affected by other factors, both personal factors and external factors, workplace factors, and the system in which you are working. And so I don't think we could have a number either way that would be valid both in Pakistan and in Sweden and in Ecuador and so on and so forth. But if I'm just to mention a few factors that would relate to this, because I know there were initially some other questions about mental health, the generally valid thing would be the better you are at taking care of yourself, in making sure you get time to rest, you get to eat regularly, sleep, physical exercise, communicate with friends, and so on, the better chances that you will kind of make your way through this without too much mental stress. And then it also depends on your colleagues, the social support you get, also the professional support you get, because if we as recent graduates would be thrown into dealing with disasters, that would not really be ideal. and then also the health system, the resources we have, and so on. I think it's really important, as Paulo was also discussing, to not only focus on medical professionals and preparing us and giving us education, because we work in the health system. If the politicians do not value our work, if we don't get the resources, it will be really hard for us to do good, regardless of what education we have. So I also sincerely hope that this pandemic will change the way the public and the politicians and everyone look at how to work with the health system and the health financing and so on and so forth. I think I kind of moved away from the core question, which would be, I don't know the numbers, unfortunately, probably elevated compared to general population according to the publications that do exist, but it wouldn't have to be that way if we could work with it better, both on an individual but also on a system level.
Exactly. So if I say that we put ourselves in medical language, ourselves before anyone else. So yeah, that would be, I don't know, that would we will get a lot of questions from people that are out there, that how can you put yourself before other people? How is yourself so important to you if you took that oath? And like, this is some kind of a question that we medical students or doctors encounter a lot in our lives. Is that so? So what will you answer in that? And that affects our mental health too. That shakes us to bits, because how, like, if we are in a system and you're working and then someone comes and tells us that how can you put yourself before anything else out there? How are you so important? So how would you answer to that question?
You all could input too, because I don't think I necessarily have more knowledge as such than anyone else. But I would say both, because if we want to be able to help, we have to survive, right? Otherwise, we won't be able to do any good anyways. So that's why also when you do ATLS or whatever, you have to put safety first, because if we're not there, we can't do anything. And secondly, I think it's also easier if we create a culture where this is encouraged, accepted firstly, but also encouraged. Not only us as individual doctors saying, okay, I'm going to rest now, but to create a workplace where the schedule allows this and where this is respected and reinforced. Oh, I can hear myself. Cool. And so I think it's difficult for many of us to say this, to say like, oh, I'm going to put myself before you. I'm going to go and eat now and sleep now. And I think it's something we have to work with ourselves. And I also think it's useful to support each other, because we are usually better at telling other people what to do than to tell ourselves what to do. So then you can also think of yourself as the second person, like what would I tell my friend, my colleague, if I saw them in this situation? But also to tell your friends and colleagues when you think they need to eat and sleep, and hopefully they do the same for you. That's my 2 cents.
But since I'm enjoying it quite a bit, I would just end it with a few questions to, like, one last question to all of the guests. So it would be like, it would also work if you answered it briefly and shortly. But yeah, I can't end it without asking you. So Maru, this is my last question to you. What do you see the future of disaster medicine related to medical education, either in IFMSA because we are a student-based organization, or in general because you would be a doctor nevertheless, be it IFMSA or no IFMSA?
Yes, thank you for this question. I think definitely we should close with a question that sees the future, and as the current pandemic has proven that nothing will be the same afterwards, and especially when it comes to medical education, because it has shifted the priorities that we have in our medical education, and disaster medicine is one of the things that should be going on our scale when it comes to the educational programs. I think as also the current pandemic has proven the need of e-learning, and that's something very medical schools are now aware of, in a way that they need to make sure that they create a balance between their educational platforms, not only when it comes to the hospital-based settings, but also when it comes to their online platforms, in a way that they can make sure that they involve medical students in all aspects of the healthcare delivery. When it comes specifically to disaster medicine, I would definitely see that there will be more involvement of medical students in the future, as Pablo has said, that there will be more outbreaks in the near future, and there should be more preparedness from a larger workforce that definitely includes medical students. And I think that in the near future there will be a start of harvesting all the knowledge and all the experiences that we have gone through the current pandemic, in order to make sure that we implement it as good practices education in the near future for maybe, let's say, the senior medical students, or the medical students are in further stages of their education. And then afterwards, there will be, in my opinion, that there should be more of a long-term vision where they can see the medical education adapting to in the different stages to addressing disaster medicine, in a way that we provide a step-by-step curriculum to medical students as per their level of education, in a way that we address different objectives throughout the whole curriculum, and that could be also addressed whether in hospital-based settings or e-learning, etc. And that's when it comes to addressing medical students, but also to medical educators are now also being educated on how to educate, and that's something very important for faculty developments in the future.
Thank you so much for your insightful answer, Mario. My second question would be for Pablo. Pablo, although it's the same question, but every person has a different approach to it. So that's what I feel. So, what do you see, since you're already a doctor and you've that's for the betterment of the students related with medical education? So how do you see it for yourself? Do you somehow think even if within this webinar or after that, do you think that you can have disaster medicine incorporated into how you see the future of it as a medical doctor in Ecuador or wherever you expect working there?
Sure, and it's a quite interesting question. Just to remember that this, as I was saying, this will be a breaking point, not just for disaster medicine, but also for public health and global health. People from different sectors will much more importance to the preparedness of, or the importance of prevention in medicine. So this will be applicable for disaster, this will be applicable for non-communicable diseases, for healthcare systems. So prevention will be the future in medicine and in many sectors of the world. So I think we are lucky that in the near future, we will be able to see the results of this. And especially myself, that I want to focus also in preventive health and public health. I think this will have a huge impact for the professions and for the different outcomes that's going to happen.
I was still here. If you think I wasn't, I was here. I listened to your answer. And that's, I'm moving to the next, and the last guest over here is Jessica. Since you were, again, I'm referring to you as the former SCORP DE, do you think that there are anything IFMSA is offering? Maru, you can jump into this question because it's a collective, approach. So do you think IFMSA is offering anything related to disaster medicine, and how do we deal with management in it, or anything you would like to say at the last of this webinar?
I definitely think IFMSA is offering something when it comes to disaster medicine. I would say I personally have learned much more from the IFMSA than from med school when it comes to disaster medicine. Now, I think it will be interesting to see how the IFMSA adapts to the current situation with the COVID, because it does affect our ways of work quite a lot, because previously, maybe still currently, the biggest disaster medicine related event in the IFMSA is the TDMT training disaster medicine trainers. And luckily they have a big part of it as an online course already. And then they have a residential course, which we will see what happens this year. And then we have had quite a lot of workshops, which have been really, it has been useful both for the participants and also for the facilitators. Now, these won't be able to take place for a while because of obvious reasons, but it will be interesting to see if we can move more of it online. And I mean, you in SCORP Pakistan are obviously also offering quite a lot of learning opportunities when it comes to disaster medicine by having these series of webinars. So I'm sure there are plenty of other activities such as this one if you want to learn more about it.
So anything you would like to say at the last, because I'm just going to take last statements from the speakers now. Anything you would like to say about the situation that's ongoing, about the mental health, about how can we keep ourselves together, that we be polite in this situation, because we don't have anything to do. So any last statements from you all? Starting from you, Jessica.
I'll just add to my last answer that I think peer education is really powerful in general. And so I feel like the IFMSA usually has been much more successful working with their methodologies, for instance, simulations, as Marwan was mentioning. And so I think we should really continue working with this. I don't think universities, or rather, I think universities could have a lot to learn from the IFMSA. And I think we should take more space in universities to show them how we can contribute to medical education.
Thank you so much. Thank you. Now I move to Aksa for your last words. We're keeping it really small.
I'll just say that everyone sitting at home as a frontline warrior in this fight right now, or even just trying to do something by providing necessities to poor or by providing PPEs to doctors, has a potential to make a difference in this society. And it's not just the doctors or the administrations or the institutions fighting this disaster, it's everyone who is struggling and surviving this as well. So never ever think that you are not enough, and take the right initiative with the right people. And IFMSA Pakistan is here to support you and to stand with you in such times to create an impact that is much more powerful than an individual impact.
Thank you so much, Aksa. Now I move to Pablo.
Yes, so my last word is, especially being an IFMSA alumni, I realized how important and how powerful a student organization can be, especially in these situations. How can wonderful students have adapt and move forward to push students to deal with these situations and to have a positive impact in their community. So yeah, as Jessica said, I would say IFMSA is one of the biggest learnings I've got from medical school. So yeah, if you had the dove, keep in IFMSA.
Okay, now lastly we have Maru. Maru, I'm so sorry for keeping for this long. I know that it's a startup. Bear with me.
No, I'm really happy to be here, and this is also a reminder to me about how we are as a global community. We are all like, even though we are in different parts of this world, and it is a privilege to be part of IFMSA because it connects us all as medical students. Even though of the difference of our contexts, we can still learn from each other, and through our international engagement. So that is a lesson that maybe I would lastly share with you. So even though you should look beyond the walls of your university or to the walls of even the borders of your country, but rather see what other people are doing out there in different countries and different communities. And that is the main key finding solutions in difficult times. It is to look into good practices and to see how we can implement them in our local context. That is the main lesson that I would maybe emphasize on today.
Thank you so much. Thank you for all my wonderful guests for joining me, for answering my questions. Some of were repetition, some of them sound so noob and stupid to you because I am no expert in the medical education, but I try to bring every concern of national people out here, the members of IFMSA Pakistan, to you experts, for them to better understand and get most out of this lockdown, or what you say, when we have nothing in hand, so they could learn, they could be a part of it, or they could at least start somewhere. Because what I personally believe is that you don't get everything in the start. You have to start somewhere, and you have to lead the way. So I hope that whatever your suggestions or whatever your answers were, it would be helpful for the people, for the passionate people and the members of IFMSA Pakistan or international people that have joined us to be of some use. So thank you so much for my speakers again. Thank you for bearing my question. Thank you for bearing me and my disastrous internet today. And thank you for the participants for joining us. This is it from my side until the round 4 with the better internet, of course. Thank you so much and have a good day.
Thank you, guys.
Thank you, everyone.
Bye-bye.
Thank you, Maha, for the invitation. Bye-bye.